As with any lifestyle change or physical exercise program, consult your physician before you begin your yoga practice. If you are pregnant, discuss your yoga practice with your yoga instructor. As your pregnancy progresses, you will need to modify or avoid certain poses. Move at your own pace and modify the poses as needed in order to maintain alignment and easy breathing in every pose. If you feel any discomfort, dizziness, or pain during your practice, either modify the pose so that you are comfortable or take a few moments to rest. It is very important that you listen to your body and practice yoga in the manner that is the safest and most comfortable for you. Namaste.
The next breath that we're going to work on is called the shining skull breath. With this breath, there's actually a controlled exhalation that occurs, and there's a movement you need to learn for that. Think about it as if you need to cough and you're in a room full of people and you don't actually want to cause a loud noise. What happens in that case when you cough while holding it in is the muscles of the abdomen, the diaphragm, punch upwards, pushing the air from you. I'd like you to try that for a second. Feel the movement of the abdomen and the diaphragm plunging inwards to push the air out of you. Okay? So with that, what we're going to do is, first of all, place yourself into a proper seated position. Plant your sitting bones, those two bony points in the bum. Lengthen the spine. Bring the back of the neck up, the crown of the head to the ceiling. Widen your shoulders and bring them down your back. You're going to inhale completely into the lowest portion of the lungs. Inhale, feel the abdomen expand, feel the ribs expand, feel the chest expand. And at that point in time, you're going to begin to exhale only with small expulsions. Now, I'm going to interrupt you for a second, because what I need you to understand is that the only thing that you're doing is controlling a short exhalation, which means that after you've plunged inward, you relax. And as the body relaxes, it will automatically draw air back into you. You're not actively inhaling, you're just relaxing, and the air will come back in. So you're not emptying the body as you're doing this plunging motion. Now, I'm doing this fairly quickly. You don't have to go at that pace. Yours can sound like this. Over time, as it becomes comfortable, you can quicken the pace. You're going to continue that for 10 to 20 expulsions. After you've completed your 10 to 20 expulsions, I want you to empty the breath completely out of the body. When you're completely empty, retain the breath. So retain on empty. No air is in the body. Close the airway. How you do that is you simply swallow, allowing the tongue to drop back and hold it there. Hold this retention for as long as possible. Now, if you have high blood pressure, when the body says it needs to breathe, you can inhale back up to 2/3 of the lungs' capacity, which essentially means you're going to inhale into the abdomen and into the rib cage. Once you've reached 2/3, close the airway again by swallowing and dropping the tongue back. For those of you who don't have high blood pressure, by now you probably do need to breathe. Inhale up to 2/3 and retain at 2/3, dropping the tongue back. Hold it for as long as you can. And again, if the body needs to breathe, if you have high blood pressure, exhale completely. Then return to a full yogic breath or normal breath for you. If you don't have high blood pressure, see if you can relax the body a little bit more. Continue to hold. When the body does need to breathe, Exhale completely. Then return either to a full yogic breath or to whatever's comfortable for you. When you first start this breath, you may need to intersplice it with that full yogic breath or with normal breathing, and then try it again. Inhale completely, expel for 10 to 20, exhale completely, and hold on empty. Inhale back to 2/3, hold at 2/3. Exhale and return back into a full yogic breath or a normal breath. As you continue to practice this, you'll be able to move from one of those straight into another one of those. Take your time, work at your pace. There is another position in which you can practice the shining skull breath. It's in a standing position. Slightly bent over, it just simply gives you ease of movement through the abdomen, which is slightly restricted when you're sitting down. As you continue to practice the shining skull breath, you'll be able to move from one shining skull breath into the next without interspacing the full yogic breath or the normal breathing between. Take your time as the body's ready. You may want to try over time moving from one shining skull to the next, then back into full yogic, then linking 3 of them, then into full yogic. And over time, your full pranayama practice within that set time can be done without interspacing anything other than the breath you're working on. There is one other piece that you can do while you're practicing the shining skull breath, and that is, as you're retaining the breath, you can choose to focus your attention on the third eye or the 6th chakra. Basically, it's that point directly between the brow, about an inch above, the point that my bindi is now sitting at. You can focus your concentration with the eyes closed. The reason that this is called the shining skull breath is that very often as you continue to practice this, that point begins to emit light inwardly. Hence, shining skull breath.